Hi, everyone. It's DocTalk. We've made it to the middle of May. And as I stand here today, both the producer, Brittany, and I are here to report that we both have COVID. Although we've not been anywhere close to each other, we've been doing this for more than 6 months now. Over the last 2 years, I've taken care of hundreds to thousands of patients with COVID, managed to avoid it, fully vaccinated and boosted. And this past Friday was in the station where we haven't had cases for months, and a number of us contracted COVID. I was sick on Monday, and we're 3 days out from that, and it's no fun. It's a no fun disease, and as I have talked to people around the country, a number of my friends have COVID. We'll talk about the severity of illness in a minute here, but these cases popping up in places across the country amongst emergency workers. And then I get on the webinar today and talk to Brittany, and it's obvious she's not feeling very well. And Brittany says, guess what? I've got COVID. And exchanging information here, very similar symptoms, a lot of respiratory and upper respiratory congestion. I'm here to say, very lucky for me, nothing in the chest as yet, but fatigued and running a fever for days is just no fun whatsoever. And both of us have what many people have had, which is a retention of taste and smell, and which is always gets knocked out for me. Any upper respiratory infection knocks out my taste and smell. And this variant of COVID doesn't seem to be doing that. The reports this week from everybody that I am affiliated with said very, very low increase in hospital cases amongst our members. We have not had anyone hospitalized. It's still a wipeout kind of a thing when you've got the disease yourself, and very much no fun. I have to say I'm at lower risk of having long COVID, but for any of us, there's always a concern that this is going to extend out or extend deep into your systems and cause you immediate problems. Always a concern and a good reason not to have this. So as we're moving in, and this is clearly outdoor time. We spent a lot of time outdoors Friday in all of our work in the department. We were in and out of well-ventilated rooms and offices and outside in the bays and doing stuff with the recruit class. And so there was no stuck inside in a not well-ventilated room. We're back in meetings, and over the last month, I've been at very enthusiastic meetings of people very happy to be together. And so this variant is very, very infectious, and it's causing breakthrough infections for people who have been vaccinated and for people who've been vaccinated and already been sick once with the disease. It is fortunately not showing the same acuity, which is bailing us out, if you will. And this hopefully is our attempt at getting to herd immunity, which is what we need. Let's talk beyond herd immunity, though, because the topic of the week really is the number of deaths that have occurred as a result of COVID, which has been overwhelming. We're at the 1 million direct deaths from COVID measured in the United States, and many, many, many more indirect deaths associated with this. And the CDC has done a count on some of those and talked about the extra deaths from mental health and overdoses. Last year, a record year for overdose deaths in the United States, with over 107,000 direct overdose deaths. Increase in cardiovascular disease, somewhat related to our breakdown of our health system and people not getting their routine cardiac care. Increase in GI deaths and cancers because people didn't get their routine screenings done. And so the death penalty remains in effect from COVID in this country. Vaccinations, high on the radar still. And moving forward, what will we do into the fall? A couple of weeks ago, I talked about getting my next vaccine in the fall. And I still may have that on the radar, depending on what might be needed and what the science shows by the time we get to the fall. Otherwise, this is my 3 vaccines and an infection, maybe my 4 exposures that I need to build my immunity to the full extent that might be needed in the fall. This week was about vaccinations for children, and this morning, Moderna announced that it had all of its data together for children and adolescents related to the protection from the vaccine and the lack of side effects of the vaccine in their study group. That was submitted to the FDA for emergency use authorization for full doses of vaccine for both adolescents and then children, and then the new group, which is 6 months to 6 years of age, which will be our next ones in the potential world of getting vaccinated. Why is this important? Well, one of my firefighters reminded me of how important this is. She has young children. She matches actually a couple of our other members who have young children. Those children have been sheltered because they have not, their parents have not wanted them to get infected. And one of them says, you know, I have multiple small children, and I have two of them that, you know, are good, healthy kids. My third one is not healthy. My third one is not healthy. And if I can't protect the third one, I have to protect the third one from the other two. And it's very important to me, Doc, that we get vaccines for the younger kids. It's not just about those individuals, but everybody that they expose. And as we have heard from the pediatric institutions about the Omicron variant, this has affected and made ill more children than the other variants have in their history. So Omicron has been more infectious to children and more dangerous for children than the other variants. We don't know when that potentially could change and become much more fatal to children, other than those with other underlying immune problems. So she explained to me in very genuine terms why it's important for children to have a vaccine available and for them to get it. And she said, your generation, Doc, went through polio, and you knew how important it was, and that originally those were great big shots, and little kids had to line up at the pediatrics office or in the civic centers and other places to get those shots. And it not only was about protecting those children, but the other children that couldn't get that protection. And then we've evolved that vaccine. And so polio vaccination is part of our routine childhood immunizations now, extraordinarily protective, and we've wiped out polio. Doc, you got to do that, and we need to do the same thing for this next generation for the coronavirus. And so her plea was move the FDA along to get that emergency use authorization for the younger kids so that everybody can be protected and we can quit spinning this amongst different generations and causing fatalities. We continue to see amongst those that are hospitalized for COVID at this point that our seniors are still at risk for dying, and they still don't tolerate this. Their immune systems, they attempt to protect them with vaccinations, but some of them still with the vaccination can't build enough immunity to protect them. And so our hospitalizations and deaths still occur in that age group. So we need to move across all of our age groups and across all of our population in this country and across the globe to get us all protected. That's the message for this week from DocTalk. I hope very much to be presenting to you next week with my normal voice back, with a little less flush in my face, because this is the time of the day when my fever always begins going up again and I feel crummy. And I certainly hope to be able to report to you over the coming weeks that I resolved this, that Brittany resolved this, that our other friends resolved this, and that this didn't become a staffing challenge for many agencies across the country and a stress test for the hospitals again, which we just don't need. So please stay healthy. Might be the point in some communities to be wearing a mask again and to be thinking about that. Our crews continue to do that in their operations and patient care. You all take care of yourself. DocTalk for mid-May. Thank you.